Bismillahirrahmanirrahim. Assalamu alaikum, respected audience. Today my topic of discussion is about neurotrophic corneal ulcers, their causes, manifestations, clinical features and possible treatment. In this photograph you can see that there is a central corneal ulcer, almost we can say 4 into 4 millimeter. And it is occupying the visual axis right in the center of the pupil. It is there, and if you see the margins of this ulcer, you can see over there that there is some swelling, loose margins along it. Yes, so this patient has shown us, and he has got almost history of 2 to 3 weeks of non-healing. This is another photograph of the same patient. Here you can see again occupying the central area, but the anterior chamber on the slit lamp on the other side you can see that it is no hypopyon over there. Of course you cannot see the cells, but there is no hypopyon, no infection, and mild conjunctival congestion and redness. In fact, the vision of the patient was also not that much affected, but the problem is it is occupying the central area. The other photograph showing both eyes of the same patient, one eye is healthy and other eye central corneal ulcer. There are no more stromal infiltrates, nothing like that, no signs of infection, and just a non-healing corneal ulcer. These are the other photographs of the same patient after 2 weeks, same condition, non-healing, corneal ulcer, central, staining positive, no signs of infection, no stromal infiltrates, mild conjunctival congestion, no involvement of the vitreous, just localized, non-healing corneal ulcer in the central area. After 2 weeks, this is the condition. In spite of doing culture and sensitivity, giving full lubricants, eye drops, antibiotic eye drops, bandage contact lens, all these things done, but it is not healing. And in spite of applying the amniotic membrane transplant. So this is the condition after 2 weeks. This is the latest photographs of the ulcer of this patient. Here you can see that in still no signs of infection. The margins of the ulcer are consisting of loose epithelium, which can be seen like a frill or a margin of opacity along the ulcer, and no corneal infiltrates, no infection still, but it is not healing up till now. With staining, still taking the stain, so there is still discontinuity of epithelium. That's why it is taking up the stain over there. So almost 3 to 4 weeks. This is a very challenging and interesting case, so I wanted to discuss with you. So what are the causes of these neurotrophic ulcers? We have to understand the pathology. We know that the cornea is a transparent structure. There is no blood supply. That's why it is transparent. That's why it transmits light. But at the same time, it is very richly supplied by the nerves. And whenever there is any damage, patient feels severe pain. But apart from this nerve supply is very critical and important for the normal health of the epithelium of the cornea. Whenever this nerve supply is damaged because of any infection like herpes zoster, herpes simplex virus, because of any surgery, any trauma, patient may be using excessive eye drops with the preservatives. Diabetic patients particularly, they also have got neuropathies. We know that diabetes affect the nerves, so they are also prone to develop these types of corneal ulcers. Comparison between conjunctiva and cornea. Cornea is many times more heavily and richly supplied by the nerves. And whenever these nerve supply to the cornea is damaged, the epithelium cells of the cornea start getting swelling up. They get swollen up. And because of this swelling, such chemical reactions happen over there that their replication, their multiplication is affected, and ultimately they undergo the process of breakdown. We know that they are regularly reproduced, but once this nerve supply is damaged, the reasons I have earlier mentioned, when these nerve supply is damaged, their health is affected. These cells undergo the process of breakdown because new production, new replication is no more going on over there. Talk about the examination of these patients. Very important is that to feel and see over there the corneal sensitivity. For corneal sensitivity, we can take the small cotton fibers, and we can put over there cotton wick over there, and we can see, because in viral infections like herpes, simplex zoster, the sensitivity of cornea is decreased. And then on examination, we can see so many other things. There may be dry eyes, we can see. There may be iris defects showing the old stromal viral infection. Also possible of scarring, old infections. So all these things are very important in examination and history of the patient. But when we come towards the treatments depends upon which stage patient has come to us. As I mentioned, they can be classified into different stages, 1, 2, 3 stage of the neurotrophic ulcers, and we can start our treatment with preservative-free lubricant eye drops. Yes, preservative-free lubricant eye drops provide an atmosphere, an environment for the healthy growth of the cornea. Secondly, there is no protection now. Anytime mycobacteria can get into the eye and cause infection. In these pictures which I showed you, there is no infection yet, but these are very prone, so they need to be covered with broad spectrum antibiotics like fluoroquinolone eye drops. They can be given over there. Number 3 thing, sometimes the patient presents with severe pain, redness, congestion and tenderness over there, because as I mentioned that the cornea is richly supplied with the corneal nerves. So patient is in severe discomfort and pain, and if there is congestion over there, so we can give him cycloplegic eye drops to break the spasm and maintain the blood aqueous barrier. Cycloplegic eye drops in the form of cyclopentolate can also be given. Thirdly, very important, when we talk about the surgical procedures, we can put temporary punctal plugs. Yes, punctal plugs can be put in these patients so that whatever the tears are, they are, especially we're talking about the dry eyes, they can be preserved over there in the eye. Also, we can go for the bandage contact lenses. The reason is the bandage, when we apply a bandage contact lens, there is no more rubbing of the eyelids on these ulcers, and it gives them chance to recover and heal. Because each time we blink, there is a mechanical rubbing over there. So that element can be avoided by putting the bandage contact lenses. Then when we talk about the bandage contact lenses, many people are moving towards the scleral, which are large size and which have got some fluids inside. These scleral bandage contact lenses can also be applied. And in spite of all these treatments, if we feel the things are not improving, then we can go for amniotic membrane transplant. Yes, amniotic membrane transplant plays a very important role in healing of these corneal ulcers. It protects them from the mechanical effects also. So it has proven of great help in the healing of these resistant types of the ulcers. One thing more when we talk about these ulcers is that the debridement you have seen in these photographs which I've showed you that there are the margins of the ulcers are loose. They are turned into opacities. That is because they are now loosely attached over there. So with gentle corneal, cotton wicks, these margins under topical anesthesia can be freshened up. So when we do this freshening of these margins, so they get more chance of healing over there. Yes. So these are different types of things which can be done depending upon which stage the patient has come to us. But as I mentioned earlier, that these are very challenging cases to manage, and these patients are prone to develop repeated infections, repeated corneal ulcers, because the nerve supply is damaged because of any cause. So these, at the same time, the physician has to keep an eye on the chances of developing infection, and that's why, as I earlier mentioned, that they need the topical antibiotic drops. If in spite of all treatments it is not healing and the ulcer is aggravating and is going towards perforation, at that time we can also go for the temporary central torsography. I mean the stitching of the eyelids in the center temporarily, so that there is no more mechanical rubbing over there. From one side of the eye we can examine, we can put eye drops, and it is also very beneficial in this. But if these patients develop perforation in spite of that, then we have to go for the corneal gluing over there. We can have to put the tectonic small graft over there, but that is very advanced stages when all maneuvers fail. But I believe if we apply, patients come to us in time and there are proper measures are done and proper treatment is done, we can manage the patients. But sometimes we have to go to these advanced strategies. I hope this presentation will be beneficial to my respected audience in the management of the neurotrophic corneal ulcers. I want to thank you for your attendance and attention. Thank you.